It's probably a combination of a lot of different things. I think, you can put it into some big baskets. For a lot of people, it's bad genetics. There are some people that just don't have strong cartilage and the cartilage wears out. For some people, it's probably alignment and the way their leg was aligned, and that's a packaging thing. That's just the way they were born. Many times it's post-traumatic. Many times it's post-traumatic, an injury, playing a high school sport or a college sport, or just whatever activity they like to do. I see a lot of motorcycle racers and extreme athletes that beat themselves up. Some people have what we deem inflammatory arthritis, where their body actually attacks their joint, and so it'll actually erode your joint over time. And then the other group would be people that have issues with the bone and or the cartilage in their hip or their knee as a result of medication they've taken for other physical ailments or other disease processes.